Right. So let's talk about labor and delivery staff, how to have a positive experience, how to set the tone.
I think it is very important because you know that when you go in for labor eval and then admitted or induction or C-section or whatnot, it's not just the provider.
Mm-hmm.
It's the nurse who will help you for every, 12 hours?
I think the nurse, sometimes, not all providers are like you and is hands-on and is involved in the process. So I think a lot of times it's more of the nurse who you have that's going to make the biggest impact on your labor and delivery experience. And I think it's important to know you're going to get good quality of care, but the more you work to build a positive relationship with your nurse, the better your labor and delivery experience is going to be.
It's one-to-one staffing like ICU. So you're going to have a very close relationship with that nurse. Mm-hmm. Maybe 12 hours, maybe 6 hours. And that person is going to make a huge difference.
Yeah, and it doesn't mean you can't advocate for yourself. It doesn't mean you have to do exactly what they say, exactly the way they want you to do it. It just means have a conversation, be respectful, put effort into building a positive relationship with that person. So that way when things come up that, maybe you don't want to do it exactly that way, or maybe you'd like to try this in a different way, you can have a conversation that's productive. They're going to be much more willing to work with you to make that experience positive for you. So it's one of those things of like, you're going to catch more flies with honey than you will with vinegar.
Are you old enough to say that saying?
I don't know. I'm in my 30s now.
What I want to say is, in very ideal world, it should be your provider who's setting the tone with you and the labor and delivery nurse and whoever else, having that positive attitude. And at some point where things have settled, you are admitted, and maybe there is just the right time to talk about your birth preferences and have just a positive environment, because you're about to undergo that most amazing life experience, and there should not be any negative energy, right? And for the most part, most labor and delivery nurses I know are invested, they're passionate, they're good at what they do, and they want to have that opportunity to show what they can and cannot do.
And I think that goes for doulas too. Again, it doesn't mean that you can't go in and help your patient advocate for themselves, or that you have to be buddy-buddy with the nurse and, not advocate with your patient. But walk in that room and your focus should be on being professional and having a positive relationship with everyone there, because it's only going to benefit your client. When I come into labor and delivery room, luckily now when we work together, most of the nurses, that you work with, I have a relationship with now. So, I don't have to say this, but when I walk in and it's a new nurse, I like to introduce myself. Hi, I'm Kaylee. I'm their doula. I'm looking forward to working with you. Please let me know if there's anything that I can do to help you, or if at any point you need me to move or get out of the way. And I think that goes a really long way, because it's saying, hey, I'm here to work with you. I respect you and I understand my role. I know my scope. I'm not touching your monitors. I'm not doing anything like that. And I'm here to help you.
And once you are seen as such a positive person, you know what happens during change of shift? Everyone fights for you. Oh, I want that room 6. Yeah. I heard she's really nice. Or I want that room 5, because you know what? They brought a dozen donuts.
Yeah.
It's that dozen donuts that makes such a big difference.
And having a provider and a care team that wants to work with you makes a difference. Having done that and built the relationships that I've done, it's been great, because I've walked into a labor and delivery unit and seen nurses that I've worked with before, and they say, oh, great, you're here. Come with me. Help me do this with the patient, or help me, let's try to get her to do this so we can, get where we need to go. Or they're more willing to let me help them move a patient, or, they're like, you know what? Yeah, you can help her rotate and move, and things that other nurses might not want me to do or not want me to be involved in at all. So building that relationship helps you as a doula. It helps your client, because you're going to be able to be more hands-on, and you're going to be able to give suggestions and be heard. And
have patients refer to you.
Yeah.
Because they've seen your work.
Yeah.
One thing that I really love seeing is when a nurse has been working with one of my patients and it's change of shift. And I feel like maybe in 30 minutes, my patient will deliver. And when I see the nurse staying on for
Yeah.
30 minutes, oh, that just touches me.
Yeah.
And patients really notice that. And for that nurse, that's why she's labor and delivery nurse.
Yeah.
You know, it's just not 12-hour, paycheck.
I mean, it's a huge moment in your life. I still remember the name of the nurse that was there when I delivered my first child almost 7 years ago. And I was only there for 2 hours before he was born. I remember, who she was, what her name was. And, for my other two children, again, now, luckily, my other two children I had at the hospital we work at often. So I get to go in and see them. And, the first time I went in after I had her, I came in and saw my labor and delivery nurse and gave her a hug. And, it's nice to know those people that were there for that most amazing moment of your life. So work to build that positive relationship with your care team. It will only help you to have a more positive experience.